Let's start talking about the endocrine system. The endocrine system is one of two main forms of communication within the body. The first one we've already talked about is the nervous system, and the second one is the endocrine system. The nervous system uses neurotransmitters as its signaling molecule, whereas the endocrine system utilizes hormones as its signaling molecule. By and large, the endocrine system is made up of glands and tissues throughout the body composed of epithelial tissue, but there are exceptions to that. So if we look at this picture right here, this just shows you how diffuse this system is. We see it up in the brain with the hypothalamus and the pituitary gland, which is going to be the bulk of this lecture. In the neck with the thyroid gland and parathyroid gland. But the heart, which is the hallmark of the cardiovascular system, does play a part in the endocrine system because it releases a signaling molecule, atrial natriuretic peptide, directly into the bloodstream, and that is a hormone. The adrenal glands, which sit atop the kidney, play an integral part in the endocrine system, as does the pancreas and other tissues, including the gonads, the ovaries in females, and the testes in males, which secrete the hormones estrogen and testosterone, respectively. What we're looking at here is an image of the brain coming off the hypothalamus. Keep in mind the hypothalamus is part of the diencephalon, which is the superior aspect of the brainstem. I should qualify that because some books and individuals do not include the diencephalon within the brainstem, but for our purposes, we do. The pituitary gland comes directly off of the hypothalamus. We can see it from the anterior viewpoint here. This is a pituitary gland. The pituitary gland is described and really is the main control center of the overall endocrine system. And we're going to talk about the pituitary gland in detail. If we look at this image right here, we're looking at the interior of the skull. Highlighted in pink and green is the sphenoid bone. And this region right here is known as the sella turcica. The depression at the bottom of the sella turcica is known as the hypophyseal fossa, and that is directly where the pituitary gland resides. It sits in the hypophyseal fossa. Okay, looking here, we have the pituitary gland in purple and in green. And above the pituitary gland, we find the hypothalamus. Keep in mind the pituitary gland descends directly from the hypothalamus. This size perspective is totally off. I've just drawn the pituitary gland large so we can get a better grasp and look at it. But one thing I want to point out, the anterior pituitary right here is composed of epithelial tissue like most endocrine glands. But the posterior pituitary is not. It is composed of nervous tissue. And that's exactly why I've color-coded it exactly like the hypothalamus. The hypothalamus, which is part of the brain, is nervous tissue. The posterior pituitary is nervous tissue. This stalk that connects the posterior pituitary directly to the hypothalamus is known as the infundibulum, and that is composed of nervous tissue as well. So we have an anterior pituitary and a posterior pituitary. And there are two alternative names for these. The anterior pituitary is known as the adenohypophysis. Keep in mind, if we look back here, the pituitary gland resides in the hypophyseal fossa, hence the term adenohypophysis. The posterior pituitary is also referred to as the neurohypophysis because it is composed of nervous tissue. And I think understanding or remembering those two alternative terms for the anterior and posterior pituitary are really important. If for nothing else, it helps you remember what type of tissue these two regions of the pituitary are composed of. All hormones, when they are secreted, go directly into the bloodstream. That is a hallmark characteristic of hormones and neurohormones. I say neurohormones because of it is released from nervous tissue and moves directly into the bloodstream we refer to those as neurohormones. If the signaling molecule is released from endocrine tissue directly into the bloodstream, we merely call them hormones. So there are 6 hormones released from the anterior pituitary, 2 hormones released from the posterior pituitary. From the posterior pituitary, we have antidiuretic hormone, otherwise known as ADH, and also known as vasopressin, and oxytocin. When they get released from the neurohypophysis, they move directly into the bloodstream. From the anterior pituitary, we have follicle-stimulating hormone, luteinizing hormone, thyroid-stimulating hormone, adrenocorticotropic hormone, prolactin, and growth hormone. So we're going to take a look at all of these in these subsequent videos.